My name is Oloruko Oba Ajagbonna. I'm opportune to introduce my chiefs, Oba, the delegation of Ooni of Ife. They have a great message from His Royal Majesty, Ooni of Ife, for each year. I would like to introduce His Royal Majesty, Oba Babatunde Tokunbo Awosunke. By his side is Prince Ishola Olatunbosun. We have Dr. Oloruko Oba Fagunroye and Dr. Oloruko Oba Adekunle Sumbo. These are the managing directors of Dr. White Ethannopharma Nigeria Limited from Osun State.
We have to make some necessary steps in the way that we register with NAFDAC. We have to make a step for all our medicine that we have for a necessary text, which we know we can participate for the whole world to solve these problems. In this case, we look at it in a way we need to explain ourselves to you, sir, to give us an advice and support how we can go about this.
We have meeting in January, February. We do the research. We get that the COVID-19, it has symptoms like measles and chickenpox and high fever. We use high fever. When I do the medicine, they go and give all nutrition before we take the step to another.
His Imperial Majesty Oba Adekunle Akonde Ogunwusi, the Ojaja II, the Ooni of Ife. He has sent me to give you his goodwill that if I'm here to meet with you concerning what we came for, that I should deliver his message that he's greeting you, that he would have been loved to be here himself, but due to some circumstances, not make it. That's why he said I should come and represent him here.
I have invited some senior directors from the Ministry of Health to join the listening, and these are the ones who will be directly responsible for this area, because this ministry has several departments and several areas, and each one is specialized in its own activity. You may know that there is one specialized in NCDC for disease surveillance and disease detection and laboratory. There is the NAFDAC, which you know very well, you mentioned NAFDAC just now. There is Primary Healthcare Development Agency. There are also other departments that have to deal with family health, with children's health, and so on. So we have a department here that also deals with traditional medicine, and they engage persons who have any kind of information on traditional medicine. We also have a department that, rather an agency that deals with pharmaceutical research. They look into medicines that are coming from nature, from plants, try and analyze it, find out what active ingredient is inside, and then try to see how to use that active ingredient in a way to try and determine the dosage, and also they recommend it to big manufacturing companies to go and produce commercially with a license agreement on the person who brought it. So the person who brought it is a person who we say that is the owner of his intellectual property, that he is the one who brought it. Now, likely to just carry out his own study, and tell us what this medicine really does and what works in it, and then look for producers, because they themselves they don't produce, so look for manufacturers who will now manufacture, advertise, sell, like Air Baker, Enzo, and all those other companies that deal with this. They are the professional, they take ideas and market.
welcome to Federal Ministry of Health, and our Honorable Minister has been able to put you through some of the processes and some of the different agencies and departments that are relevant to what you came for. I just want to say that I'm Director of Public Health, and I want to tell you that we trust that your medicines will be of public health interests, in that they will be efficient, they will help most of the people, because the stage in which we are in with COVID-19 is community transmission. That means a lot of people in the communities are just being affected, impacted by this COVID-19 thing. So we are really looking for a way to stop the transmission and to help people, those who are already impacted, to get better as fast and as soon as possible. So we're trusting that your medicines will be quite potent, quite effective, quite and available, easily available and cheap, because once again we're dealing with the communities. So I will hand over to my colleague, who is a specialist in traditional and alternative medicine, at which you have more things to say.
I am particularly pleased to see distinguished Royal Highnesses coming to express a matter of concern to the Ministry of Health. Not only doing that, trying to represent your role in what you have done through the Chief Adekunle Oloruko Oba Sumbo. Yes. Am I right?
You're right.
Being a traditional medicine expert. We want to thank His Royal Highness for his interest in traditional medicine, because some few months ago we saw his submission on the media, where when this was expressed earlier enough, Honourable Minister, the Royal Highness gave some formula on the media. And when I saw that formula, I smiled within me, and I was pleased within me. Why I did that is because I understand what he understands. But he may not know, generally some people may not understand the purpose of his presentation. Because you know, the world of science and the world of particularly Ministry of Health will have some protocols, okay? But I know that as a traditional medicine, as a ruler, traditionally, he gives his domain directive. So he's quick to say, go and do this, go and do this. That was something that we should commend him for. And it's highly commendable.
Thank you. Thank you so much.
I would want him to continue, because we also know that when traditional people, like people of his caliber, say something, it's a lot of meaning and wisdom. Yes. And I believe we in the science world, it is time we listen to both parties so that we can move forward. I believe from then on he had gone to the next level. The next level in trying to go and sit down and have a plan of action. Yes. To be able to move his formula forward, so that it can now follow the due process. And by so doing, we know that it will help our people. Honourable Minister, sir, you know my passion for traditional medicine. You know that. And I want to say it's in me, and it cannot change. I'm one of you. I inherited it, and thank God I went to read pharmacy. So that always gives me the sense of what I should bring your attention to. It's not enough. It's not enough for us to say, this is the formula. Those of us in it know that this is the formula, because we were given by God. It's an intuition. Okay, and God cannot make mistakes. But when we bring it out to the domain of the public, we must have an established protocol. And these protocols are identified as scientific. There are steps. And I really appreciate that you have taken the steps. Our interests, we have seen that you have gone to NAFDAC. But more importantly, with your coming here, we want to do your attention for you to know that the Honourable Minister and the Minister of Health is the first time they are really paying attention to the messages from traditional medicine practitioners. Why do I say that? About 4 weeks ago, There are practitioners, you see him at the forum of the Presidential Task Force. Honorable Minister will always say, come to the department. There is a department. Come and make your submissions. And then the other protocols will be followed.
Yes.
And you may wish to know that we received some submissions. The first batch of submissions, we had 19 submissions. And then the minister directed, with the directives, organized a meeting with those submissions. And people could not believe it because they always have this mentality that Minister of Health is against traditional medicine. No, we just want to wonder. All we need is collaboration and communication and respect for ourselves. From the world of science and from the world of traditional medicine. Nobody knows it all. If we're able to meet and do the right thing, it will really help our people, sir. The passion is that no drug has come out of Africa. And I know we can have more drugs out of Africa. But if we are able to follow these protocols. Exactly. So for the submission, I hope there will be a letter. The letter sent to the Honorable Minister stating that this is what they have produced and this is the belief of the product. What we do when it comes to us, we try to invite you verbally. I mean, we try to invite you because of course, obvious reasons you cannot. We discuss with you even on phone. What did you say your product is? We have a template, Honorable Minister. Yes. We have indications on those templates. And it's that template we use to get some basic information. And when we do that, we make the appropriate recommendations. If you are listed with NAFDAC already, and we believe your product has a role in COVID-19, and once you say it has a role that is symptomatic, it can be looked at. But when you say curative, it's a complete another different message. Because you need to make some more submissions to believe that it's curative. But if it's symptomatic and is listed with NAFDAC, we request for a validation. If it is not listed with NAFDAC, we have now recommended with the directive of the ministry, submissions are now currently being evaluated for NAFDAC. And once they evaluate, there are two stages. Either listing your product, and then further stage is the clinical trials. So it depends on whichever stage we want to look at it. So I want to really say that we really appreciate your visit, and this is first of its kind. And we are really, we thank on behalf of the ministry and the minister who has been giving the support, is making sure there is a correct bill, Traditional Medicine Council bill, to be passed so that we can have a council. And with that council, at times you don't need to have, there won't be much of this pressure here. It will be easy for you to go. But the department is doing well under his supervision, and we are being given opportunity to do the needful, and honestly things are moving in the positive way.